So my name is Dr. Kannan. I'm consultant diabetologist at present working at Alagar Diabetes Care Center, Annanagar, Madurai. So basically, I finished my MBS, followed by I did my diabetic course, and followed by I did my various certificate course for diabetes. So this field, I have 15 years. I have worked in for diabetes only. So previously, I have practiced in somewhere corporate hospital. Now I started my own practice. So I'm happy to meet you all in this platform, talking regarding about that basic awareness program like that hypertension. Okay, we all know that hypertension. Simply we say that blood pressure. Okay, in our language, what we say that blood pressure. In our medical term, we call it as it's a hypertension. So same thing, same word is one. Good. Now because some patient, if you say that hypertension, they don't know. So if you say simple blood pressure means only they have awareness. So today I'm going to discuss about that blood pressure, regarding the blood pressure of it. So how to prevent that blood pressure or hypertension in the world nowadays. Okay. So generally, what we think, always we thought whenever we feel we have no hypertension, we have no diabetes, we have no cholesterol, okay, but we want to do some of the routine follow. That time only we can able to understand we have the diabetes or hypertension or dyslipidemia. Okay, so let me discuss about the hypertension. So basically, before going hypertension, I want to tell about the heart, how is functioning. Okay, so we all know that laptop sound. So the heart is doing that laptop sound. So when that sound means that heart vessels brushing, okay, there is a compression and relaxation. So whenever there is a compression, relaxation, the blood is going out to the vessels. It's a pumping. It's a heartbeat. They say that it's a pumping level. So the contraction and relaxation. So this is called a normal beat. This is called a normal blood pressure. Okay. So every day our heart is doing like compression and relaxation, compression and relaxation. Okay. So this is doing when we are walking a street, climbing a staircase, and you are sitting in Shobha. So it will based on your body health. So it will react that your compression relaxation. Suddenly, if you are running means your heart pumping the more blood pressure. Okay. So this will happen. So what happens? Sometimes that pumping will continue for a long time, for fastly. Okay. So the pumping, the blood pressure remaining high level, the pumping capacity is having some high level. So this may called something high blood pressure or hypertension. We say that. So what will happen when the continuous the process of high pressure in the heart? So it may develop some systemic disorder, like we say that heart attack, kidney disease, and other like foot stroke. So all the thing it's coming, the brain blood clotting. Okay, this all the thing happen in hypertension patients. Okay, so basically this hypertension is doing some of the complications. So what the risk, how to prevent it? Okay, we want to know that how to prevent it. Okay, basically, but how it happening, this type of hypertension, normally it won't come. Okay, normally it won't, but there is some risk factor is there. Some of the risk factor is there. Like what is it that you are not doing regular exercise, and you are obese, you are a smoker, you are a alcohol consumption, you are a more stressed. Okay, so these are the factors. It's most common to develop hypertension or high blood pressure. Okay, so if you take it in other some related, so this what I said that physical activities, obesity, smoking, alcohol, stress, these are the modifiable factors. You can change. If you are a smoker, stop. If you are alcoholic, stop. If you are stressed, you can change your mindset. So if you are not doing your physical activities, go ahead walking. So we are having obesity reduced. So these are the modified risk factors. Some other thing is non-modified risk factor also is there. So that means what we say that you can't change the risk factor. Like for example, age, your family history, okay, and some of the stress. These are the things you can't go with that not modifiable risk factor. Age it can change, and your family history, your gene having some hypertension thing. So that's also one of the risk factor for you. And this other thing. And other than thing, in the diet point of view, what is it that in taking of high sodium intake, like the salt, high salt diet may also contribute to your high blood pressure. That means hypertension. Okay, so with this thing, so where are the high salted diet? We say that the processed food, packed food, all having the high salted diet. So packed food, you can see that some of the shop they have packed food is there, and processed food, processed how long they kept for 1 week also that eating food. They have some of the high salted food. So this type of diet pattern can lead high blood pressure and hypertension. Okay, so another that important word I can say is hypertension is a silent killer. Why? Previously I was discussing about that hypertension, it's not showing any symptom. Silently will be there. Whenever we are going some hospital or whenever we are seeing some camps or something, we are small regular checkup we'll do, that time we can finding that. So same thing, what happened, that hypertension will not show any symptoms. It's very less. There is a symptomatic, is there, some symptomatic patient is there, but initial stages they don't have too much symptom. So without symptom, the hypertension producing a lot of complication, like earlier I had discussed the cardiovascular disease, kidney disease, stroke, and eye damaging, something, the hypertensive retinopathy we call it as. So these are the things will happen. So without knowing hypertension, the patient had some cardiac disease means, so this called, that's the reason we say that silent killer. The basic hypertension, we won't diagnose it. Suddenly one day we got some heart attack, so we will get. That's the thing. I am saying that it's a silent killer. Okay. Then, so we need, that's the reason I'm saying that we need to detect this hypertension or high blood pressure in early stage. Okay. So whenever you are going any hospital, accompanying with your family members, or any camp or whatever thing, if you are doing anywhere else nearby, so you can go and check it your blood pressure. Or my advice is, you are working people or your age more than 30, you want to do regular blood pressure monitoring. Okay, I will discuss how you want to do it. So one thing I said there about, it's a non-symptom. Symptom means Tamil sonna arivurin solla. So ungalku endha oru symptom me irukadu. So it is a no symptomatic persons. The hypertension. So some people have some symptoms. So what are the symptoms? They will feel like that, the morning headache, so or tiredness, and some of the vision changes and blurring of ears and fatigue, nausea, vomiting. Okay, so these are the symptoms basically that hypertension people will feel that. That also to high BP people. High BP people, they get fatigue, tiredness, nausea, vomiting, and the blurring of things. So this can be one of some of the, I can say it's very, very less. Okay, mostly hypertension, it's monitored only at the regular checkup or accidentally only, and most of the people, they won't have any symptoms. Okay, so then how this hypertension is monitoring by lab or any other instrument? Yes, there is one instrument is there. There's a sphygmomanometer. Okay, so most of the hospital, you go on anywhere in the clinic, even some rural village, we have the one cuff. We have one cuff will surround our arms. So this is a simple blood pressure monitoring system. So all over that hospital, clinic, or nursing home, small thing, and everywhere is there. So we'll monitor that blood pressure by the sphygmomanometry. Okay, so in this, how we'll know that? So the doctor will tell the two values. Okay, like for example, your blood pressure is 120/80 millimeter of mercury. So what is that 120? What is that 180? So there is two things. One is the systolic, one is the diastolic. So I previously said that contraction and relaxation. Okay, so the contraction is the systolic and relaxation is the diastolic. Okay, it's represented. So how the contraction relaxation is happened, what is the pressure level mean, it's giving them. So it's 120/80 millimeter of mercury, it's normal blood pressure. Okay, so that 120 it's called systolic, 80 it's called diastolic. So if 140 or 90 millimeter of mercury, the patient having, we say that is a person having high blood pressure. It's maybe we say that hypertension or hypertension. So 120 by 80 is normal. Even 110 by 70 it's also normal. 130 by 80 it's also normal. When the patient going behind 140 by 90, we say that hypertension or high blood pressure. Okay, so on this point, we need to take care of the treatment. So treatment is various, what is that? So basically what I will advise that initially the lifestyle modification, like do more walking, less diet, oil diet, less salt control, like that I'll advise the persons. Okay, so these are the things we need to follow that. So another that one important day I want to tell in this platform. So recently we have celebrated the World Hypertension Day and May 17th. So May 17th it's called World Hypertension Day. Okay, so why this the day is celebrating the each day one thing. So that means that we need to increase awareness on the day. That's the reason someday they have selected and they have fixed that the hypertension. So this year that WHO, they have announced about the theme of World Diabetes Day. So World Hypertension Day theme is measure your blood sugar, control it and live longer. Okay. So these are the things that the theme was given that the last hypertension day. Okay. Okay. So what the theme also they are saying that so they have if you want to prevent your hypertension or high blood pressure, you need to follow that various stage. Okay. So initially I said that lifestyle therapy. Okay. And the second one is medicine. So what is a lifestyle modification? Lifestyle modification is including your exercise, your diet, your personal life habits like smoking, alcohol, and you need to go with it, your regular monitoring of blood sugar and stress management. Followed by next is medications. So in say regular exercise. Okay, sir, I'm doing I'm walking in our office and somewhere else working places. Okay, so it's also counted as my see, this is not like that. You need to concentrate. You need to go regular walking. Minimum 30 minutes per day, it's a thing. Because when the heart is pumping more, your heart will develop more strong. When your heart is more strong, that blood pressure will come. Okay, so the pumping capacity will improve, your heart wall will strengthening. So then that you can prevent the hypertension. Okay, so another thing that obesity. Okay, so obesity also will increase in your blood pressure. So if you do some of more physical activities, means it will help to reduce your obesity. It will also prevent your blood pressure or hypertension level. And second point is diet. The lifestyle modification is diet. See, the diet is very important role. Okay, so you need to add in your diet plan like vegetables, fruit, whole grains. Okay, so that means that DAS diet. So DAS diets mean it's a standard diet for hypertension. Okay, so it consists of whole grains, fruits, vegetables, and low fat diets and less cholesterol diet. So this kind of diet will help to reduce your blood pressure. And that again, we say that in the fat, in the oil, we say that saturated fat. So eating less saturated fat and total fat also improve your health to prevent your hypertension. And take plenty of potassiums. So potassium more in the green vegetables like all leaf vegetables, all having that high potassium. So you can take a lot of green color or leaf vegetables, it's more high potassium, then you can go with. And restrict your sodium intake and reduce your alcohol consumptions also. Okay, the processed food you need to reduce. So I mean specifically going to tell about that sodium diet in your following. So the main culprit whenever we saw the hypertension patient, they have eaten outside food. Okay, so high outside food with oil, with the packed or processed food. So that the sodium level, the small amount of sodium level also will increasing that hypertension around 5 to 6 millimeter of mercury. So whenever you are choosing a processed food, check the label. Okay, how the sodium content of the product. If the sodium content of sodium content is less, then you can select the product. Then you can do. So and also the 1 teaspoon. I want to tell about that 1 teaspoon salt having 2,300 grams of sodium. So based on this, you can calculate. You can add your salt also. So basically, what we say that around 5 gram per day for the salt, 5 to 6 gram you can take per day salt. If the patient having the hypertension, any other cardiac disease, we say that 4 gram per day it's enough for the salt. So better to you reduce the salt intake. And the personal lifestyle changes like smoking. So smoking is one of the major part in developing the hypertension or high blood pressure. So we need to stop smoking. Okay, so we don't know about how many days or how many years or long you have taken the smoking. So you now onwards you stop your smoking. Okay, and it will help you for. So again, it's a hypertension. It's a very silent killer. And when you are a smoker, you're having the double risk of developing your all cardiac stroke, heart attack, and kidney problem also, and something that gangrene. We say that toe black is toe color. There's the last chance is remove your toe or remove your foot. That's a chance. Okay, so when the smoker will develop hypertension, after that hypertension also he continuing the smoking means he will get some severe complications. Okay, that's also it's I say irreversible complication. I can say that it might occur. And so all of that we did lifestyle modification and more lifestyle alcohol also you can restriction. Okay, you need to reduce your alcohol intake also. So then with the minor thing, so you changed your lifestyle pattern, diet pattern, your all the thing. So again, you need to monitoring your blood pressure. Okay, so I said the sphygmo manometer, it's for used in hospital. How can I check it in a home? So there is a lot of automatic digital PP apparatus is there. You can go and keep it in your house. You can check, you monitor. Don't monitor in single time. Check, so monitor the single time. Then you can say that I have my high blood pressure. Okay, at least you need to monitor thrice or 4 times, thrice or 5 times at a time, and different time period. Then take the average blood pressure. Then you can look at your blood pressure level. Don't do one time blood pressure. Take one, if you are taking 5 times at the same time with the same arms or different arms at different time period in a day, then you can come with your mean average of your blood pressure. Then you can show that your hypertension or not. Okay, so like that you can measure. And also this thing you can do for weekly once. If there is a high risk means you can do it weekly twice or thrice. If you want to monitoring it, it's a monthly, some periodical checkup, you can go and do it. Another most important thing is stress management for the hypertension. Okay, nowadays wherever you ask any people, if school going children or office or elderly people or wherever you can ask the people, always all the people will say that stress, I'm having the more stress. So these are the things we are facing. So we need to stress, we need to balance the stress. The stress is different, psychotic stress and emotional. There is a big topic, but basically I'm telling that stress. What are the stress? You need to control yourself. You can do it like yoga, exercise, or you do listening music, and something, talking with your best one, go with your friends with the best thing, and talking with the positive things. These are the things for stress management, reduce your stress level. Okay. Still now we have discussed about something lifestyle modification. So now if the blood pressure is not reduced with the various lifestyle modification, then what you will do? So medication. Yeah. So what is it? More than 140 or 90 millimeter of mercury, very hypertension, you need to go get medications. Okay. So there's a lot of medicines also available. Okay. You can, as per your doctor, go ahead. Okay, based on your doctor advice, based on your health, doctor will give that molecule. Don't take self-medication. It's highly injurious to you. Discuss with the doctor and take it. Okay. At the same time, don't try. If your lifestyle modification does not reduce your blood pressure, please go and discuss with the doctor. Okay, it's a ideal. So worrying about taking medication, okay, and some of the social stigma, all the things you have seen. I'm not a patient. I'm seeing in hypertension. So these are the things not all help to you. So better you go and see your doctor, get some medications. Okay, so based on your blood pressure variation, doctor will give the medication. So this is a various things I want to tell about hypertension. So what are the risk factor? What is the normal value? How to check? So how to maintain? What are the lifestyle modification? And followed by the medicines. I hope this will help. This will help for you. Thing. So with this, I will finish my talk. And thank you everyone for your kind listening. Go ahead and follow that instruction. Thank you. Thank you all.